Imagine spending 22 hours of your day in bed, having heart palpitations, forgetting your child's name, and not being able to speak sometimes. Pretty scary. Well, it gets worse. Doctors can't find anything wrong with you, and people say it's all in your head. Millions are leading a pretty isolated existence with very little support and no cure in sight for their condition, long COVID. I'm Anelise Borges, and this is The Stream.
Okay, here's another day in my life living with long COVID, a video that nobody asked for. Anyways, got all strapped up again, and today's agenda included chest x-rays, blood work, and getting a heart rate monitor installed.
Do not come in episodes. I wake up, I feel like this. I go to bed, I feel like this.
This is now the fate of millions of people.
For 1,000+ days of long COVID, am I getting any better? Am I seeing any improvements?
Smell it first. See if you can smell it. Is it normally, would you be able to smell it? Oh.
Currently, there is no cure. There's just time, hopes, and prayers.
Hopes and prayers might not cut it for the estimated 65 million so-called long haulers, patients who report a list of over 200 symptoms that can sometimes last for months or even years. Could this be the world's next public health crisis? To discuss that, we're joined today by Dr. Nisreen Alwan, Professor of Public Health at the University of Southampton and advisor to the Long COVID Support Group. She is in Hampshire in the UK. Mark Faghy, a long COVID researcher and associate professor in respiratory physiology at the University of Derby in Nottingham. And Tracey Thompson, who first contracted COVID in March 2020 and has had long COVID ever since. She's joining us from Toronto. Thank you so much for joining us today. We really appreciate your time. Before we begin this conversation, I would like to start sharing a video that Tracey sent to us. Here's a look into what her life has been like with long COVID.
This is my bed slash nest, where I spend about 20 or 23 hours, depending on the day. My side table where I keep all my medications, water, toothbrush, toothpaste, in case I can't get up that day. And then if I'm having a very good day, I can spend a couple of hours sitting in this chair, either looking out the window or using my computer if I can tolerate screens that day. And there's my little handy phone holder because I don't always have the energy to hold it. And yeah, that's, barring some terrifying incidents, that's pretty much been my life for the last 3.5 years. It's very isolating. It's very boring. I don't recommend it.
Tracey, wow, 22, 23 hours in a day in bed sometimes. I can only imagine how hard it is. And I can only imagine how much this has changed your life.
Yeah, it's been a huge difference. I had a very active job before and a dog that I was very fond of. So I worked in the restaurant industry, so long hours, lots of mental calculations, lots of physical stuff, and lots of people. And now I have none of those things.
Dr. Nisreen, is the problem with long COVID the fact that there is this absence of what doctors call identifiable biomarkers, these measurable changes in people's bodies that can actually be tested to understand whether or not a patient actually has long COVID?
Yes, that is certainly a barrier to have this single test to tell you whether you've got long COVID or not. But I think it's very important to bear in mind that many health conditions and many diseases who have been with us for a long time still don't have that single biomarker, and that certainly shouldn't be used as an excuse to dismiss or deny treatment and care for people with long COVID. It's not a unique situation, but and also we may never get there. There is a risk of reaching out, sort of waiting for such biomarker, which will be 100% accurate to identify long COVID. And I think that's unlikely in the world of medicine. And we shouldn't dismiss. I think care should take into account that it needs to address the needs of patients before waiting for such biomarker, if it ever happens.
Mark, you research long COVID. Have there been advances in our understanding of this disease?
Yeah, there has. I think we've made great progress as well over the last few years, but we are still faced with challenges and uncertainties around the explicit kind of pathophysiological mechanisms. And, you know, I agree with what Nisreen was just saying, that hoping for a single biomarker or a single explanation for something so complex is actually probably beyond our reach. But we are starting to make progress in understanding that. But, you know, the need for patients like Tracey and those around the world is now, you know, this is their reality, and, you know, there's that urgency for us to get there sooner so that we can help people.
Tracey, can I ask you, what would a normal day look like for you today?
So today is a little exceptional, but so I wake up, I take whatever medications I'm supposed to take at that time. And then I sort of wait to see how the day is going to unfold, because obviously some days I have more mobility, more energy, more cognitive power than others. So on days that turn out to be good days, you know, I try to go for a walk, organize my week, you know, prepare food. You know, if I'm very, very, very ambitious, I might try to do some laundry, but that's sort of like low down the list of priorities. So on an average day, the priority is making sure I eat something and making sure I take my meds. And then it sort of, you know, depends on the day what's going to happen. Other than that.
The one thing that seems to baffle medical specialists about long COVID is the wide variety of symptoms their patients experience. Take a look. Tracey, can you share with us some of the symptoms that kind of triggered you to think there was something wrong with you and that this could be indeed long COVID?
Well, I mean, because I was sort of in the early phase, that phrase long COVID didn't exist. So I was very much of the feeling that, you know, since I wasn't hospitalized, since I didn't require critical care, that I was going to be well in a couple of weeks. And as the weeks and months went on, it actually took me, I think, about 5 to 6 weeks to lose my sense of taste and smell. And that was a profound event, because it was obviously neurological, where I was eating something and I wasn't congested in any way. And I went from, you know, thinking this is delicious to nothing, just an absence of information going to my brain. And so that was sort of my big, like, oh, things are terribly wrong. And it's been a cascade of events since then.
Nisreen, does this long list of symptoms and the fact that every patient seems to get a different set of them, does that explain why this disease is still so poorly understood?
Yeah, I mean, long COVID has a wide variety of symptoms. There are some symptoms more common than others that people have described. There have been many studies now to look at the variety of symptoms and how they cluster together. What we do know that in most people is what we call a multi-system disease. So more than one system in the body, whether that's kind of your general body, your gut, you know, your heart, your respiration, lungs. Usually it's a multi-system disease. And also what Tracey mentioned is very common about the fluctuating nature of long COVID, where you would have some days or weeks or even months who are much worse than other periods, and so for some people, some of the symptoms might disappear for a while and come back, which is very, very frustrating, and that's why recovery is very difficult to define in long COVID, and it affects all sorts of things because you think you picked up, you can go back to work full time, do all the things you used to do before, and then it hits you again, and so on and so on and so on. So it's quite disabling in that sense as well, you know, in the sense that even in periods where you get better, you are anticipating, you know, having learned, you are anticipating to get worse, and you're trying to build your functionality and work and caring responsibility around it.
Mark, I see you nodding there. Do you agree?
Yeah, absolutely. I was just hoping to come in and say I think the biggest challenge for patients and people trying to, you know, provide support services for people with long COVID is the unpredictability. It's the fact that it can be, you know, you can look like you're on an upward trend and then very soon you're taking, you know, multiple steps backward, and that makes it hard for people like Tracey to actually be able to plan, you know, their days and their weeks, and that unpredictability, the episodic nature is really what's creating one of the additional challenges for us trying to understand the condition alongside the kind of the detailed mechanistic pathophysiologic side of it, because the interactions and the integrated nature of the disease, as Nisreen said, was multi-system. It is that exactly, and that when the systems start interacting in different ways, the responses are very different in terms of the outputs for the patients. And what we've seen very much is that it is very personal to the individual. And we've been researching this for you know, over 3 years now, and we haven't seen any patients that present with the same profile of symptoms or kind of disability. And that makes it hard for us to pull together a series of ideas or interventions or support pathways to help patients.
It must be very, very frustrating. While researching for this show, we actually came across a wide variety of videos online with people sharing their experience. And this is Laura, who posted about her long COVID journey.
I'm still surrounded by people who think that COVID is just a cold, or it's just the flu, or it's not a big deal, when I've literally had all these really intense reactions to just the virus after it my body, and you're still acting like it's not a big deal. I'm trying to be positive, but it's really hard to be positive when everything's been taken from you. And no one seems to care. No one seems to really see the seriousness of the situation.
Tracey, does this feeling of being unheard, the sense of feeling unheard, does it resonate with you?
Absolutely. It's, you know, when you start telling people like you're allergic to almost everything, you're exhausted all the time, your heart doesn't work, your brain doesn't work, your legs doesn't work, your skin hurts, people just sort of, I mean, it's you know, it's sort of beyond belief. You know, to try and not be so frustrated with being dismissed this way, I try to remind myself that I don't think that there's anything anyone could have said to me to describe what this illness does that would have prepared me for it. I don't know if there's a way to convey it. You know, I know people who have long COVID that have, you know, suffered through cancer, people who have had babies, which is, you know, a pretty physically traumatic experience. And they're like, that's a cakewalk compared to this. So because it is everywhere in your body, because it does wax and wane, and you sort of look, you know, I mean, you look like a tired version of your normal self. They're not like these big outward markers unless you're using mobility aids to let people know things aren't okay. And it is very isolating. It is very difficult to get people to, you know, sort of generally believe you, and then specifically if they do even understand what this experience is like.
Nisreen, do many long haulers come to you with the same kind of complaint?
I think what Tracey's describing, and in the video, the impact of stigma, you know, with the people who are with long COVID, we did a survey of hundreds of people, and we found appalling levels of stigma. So things like people actually, you know, experiencing discrimination. About 2/3 of people who we surveyed, about 1 in 10 actually internalize the stigma. So they feel sense of embarrassment and shame because of all the experiences they have. And about 1 in 10 also anticipate the stigma. So that means that prevents them from actually sharing their experiences with healthcare professionals, with, you know, their employers, etc. I mean, the people who are sharing the videos, Tracey here, they are heroes, because there are all these stigma and all of these barriers telling people, don't talk about this. You know, you might be disbelieved, you might be dismissed. Just go, don't mention it. Try and pretend that everything is normal, or try and label it with other things. And I think people coming forward and talking about it, really important. That's how long COVID got the attention, you know, with that patient movement. But I think it's really important for healthcare professionals also to recognize that it's very hard for people in our survey, about 2/3 said they're very careful about who they tell about long COVID. About 1/3 regretted telling somebody about long COVID. So there is this barrier, and I think there needs to be awareness about this, and not an expectation that it's like any other illness, or, you know, I mean, many illnesses have stigma attached to them, but actually long COVID, because of all the pandemic experience we've gone through, and because of, you know, its non-specificity, as we've described, in some cases, it comes with this additional stigma. And I think we all should be talking about this more.
It's very interesting. Many of the patients turn to online groups, for example, to try and get some kind of support. We actually found a very interesting take on X. This is from Patty Smith, who says, we aren't doing any effective research about long COVID yet because we haven't figured out how big pharma can make profit from it. Mark, what do you make of this? Do the profit prospects of pharmaceutical companies play a role in here? How much, I don't know, funding are you getting right now, for example, for your research?
Yeah, so I think we've been very lucky in terms of attracting research. I think my main point I'd like to make is that there is nowhere near enough funding for long COVID research, and to do that well, again, given the complexities. But as a group, we've been really fortunate. We've pulled down, you know, over £2.5 million worth of research, including from pharmaceutical companies as well, trying to, you know, increase the understanding and the mechanistic understanding, because that's the only way we're going to be able to move towards developing effective interventions and support pathways. So whilst we've been lucky as a group, if I speak collectively for researchers within long COVID, that isn't the case. And with you know, there's a distinct shortage of funding and the prioritization of research funding internationally to allow us to better get a handle on you know, long COVID, the mechanistic understanding, but ultimately to support patients like Tracey and those millions of people living around the world.
And this isn't just about the health of all those people suffering. Long COVID also has a significant impact on economies worldwide. Our producer, Joanna Hose, talks us through some of the numbers.
If 65 million people estimated to have long COVID right now sounds like a lot, well, that number is expected to grow to 200 million over the next 10 years. That's double the number of people suffering from cancer and nearly as high as the amount of people with heart disease. And with so many people stuck at home, unable to work, consider what that means for job markets and the economy. Take the United States. According to the US Centers for Disease Control and Prevention, around 6% of American adults are experiencing symptoms following a COVID infection that have lasted for months or years and that might not resolve at all. That, according to scientific journal Nature, could cost the US economy more than $3 trillion over the next 5 years. Another example, Australia. The research group Impact Economics and Policy there estimates that at least 40,000 Australians are currently unable to work as a result of long COVID, costing the country's GDP $3.6 billion a year. And those numbers are probably conservative. Not only is the prevalence of long COVID expected to be much higher, but most studies base their calculations on the number of long haulers that are off work. Were you to take into account, for example, the economic impacts of patients' decreased productivity or their decreased spending power as a result of medical costs, well then the total bill comes in much higher.
Yeah, because we talk about 65 million people estimated to have long COVID right now, but that number is projected to grow to 200 million in 10 years. That is the whole population of my home country, Brazil, for example. And that is way too many people outside of the job market, stuck at home, not being able to work. I mean, the impact on the economy is going to be quite huge. I mean, Nisreen, do you think governments are taking this situation and these staggering numbers seriously enough?
I don't think governments are taking the situation seriously enough. And also the fact that we still have COVID and you could still get long COVID. It's not something in the past. And we're not really taking the prevention or reduction of the cases of COVID seriously anymore. We're not talking about lockdown and people staying at home. We're talking about things like, much cleaner air, air filtration and better ventilation in workspaces. And also, obviously, we know now there is consistent evidence that COVID vaccination is linked to a reduced risk of getting long COVID. So that's that message. I think long COVID needs to be at the forefront of everything we kind of talk about in terms of, in relation to COVID, so in terms of vaccination, in terms of trying to reduce the number of cases. But also, I would like to point out, not everybody with long COVID will be out of work. And I think employers have this responsibility of allowing some flexibility, allowing those changes that people can, make and adapt to in order to, be productive and carry on with work in a way that suits them. And obviously with that, there is huge health inequalities because we know that maybe, some jobs are much more less flexible, manual jobs, other jobs and some other jobs. For example, I have experienced long COVID, got it in 2020. And I was lucky enough because in my job, I could be flexible in terms of, how I do my job, sitting at a desk, trying to kind of have some adjustments. And I recognize that many people with long COVID don't have this flexibility, so they'll be completely out of job. And I think employers, governments need to start looking at that seriously.
Tracey, if you don't mind me asking, what kind of support are you getting right now? I mean, you mentioned you can't work. You used to work long hours in restaurants. I believe you were a chef. So can you tell me now how are you getting by?
Relying on the kindness of strangers, I suppose. I've been sort of living off of fundraising for the time being. And the long COVID sort of community at large has been very supportive of helping me stay housed. I had lost, like I said, pretty much everything. I did kind of, I'm sorry to do this, but I did want to sort of come back to this like 65 million people and a stigma thing, because I think everybody who is dealing with long COVID, who is like myself, sort of very public about their struggles, probably knows at least one or two people, secret long haulers that are not public, and or are telling, I've got a couple of friends who are telling me about the difficulties they've had or, ongoing health problems they've had since their COVID infection, but they don't want to be described as long haulers. They don't want to put that label on themselves. And so they don't with their healthcare professionals, and they're sort of not making the connect where we're seeing sort of like, excess debilitation, illness, sometimes mortality, in the wake of this, for me, ongoing pandemic. And so I think that like 65 million is a large number, but I don't know if it's really sort of capturing the breadth of how this is impacting people. And again, the number of people who are not making the connection and are not willing to, obviously, as we talked about for stigma, come forward and say, this is what's been happening to me.
Mark, I believe you want to jump in?
Yeah, I was just gonna say I completely agree with Tracey. I think the 65 million are the ones that we're aware of and the ones that we know about. And I think internationally there's been a scaling back of testing and vaccination, etc. And as a result of that, people might not be connecting the dots between having, a cold or flu-like illness and then feeling unwell for a period of time after. So I think the prevalence of long COVID is actually much higher than the statistics that we've got at the moment. And I think, as time progresses, that prevalence will only increase. And I think you mentioned, 200 million in 10 years. And I think with the current approach to public health messaging and the awareness around long COVID, it could actually be more than that when the time arrives.
Well, it is indeed a very big story, one that we will continue to follow here. I would like to thank the three of you for joining us today, Tracey, Nisreen and Mark. We really appreciate your time. And thank you very much for watching. Don't forget, you can get in touch with us on social media, especially if you have a conversation or a topic that you'd like to flag for us. You can use the hashtag or the handle AJStream, and we will look into it. Take care, and I'll see you soon.